Hello and welcome to the second day of the virtual workshop, Community-Led Initiatives for Population Health Improvement. I'm Ray Baxter. I'm a trustee of the Blue Shield of California Foundation and a board director of the CDC Foundation. I'm a co-chair of the Roundtable on Population Health Improvement, along with my colleague, Kirsten Bivens-Domingo. Today, we will hold the last two sessions of this workshop, which is being presented in 6 sessions over 2 days. Yesterday, we had 4 one-hour sessions on community power. If you missed them, you'll be able to see them on the Roundtable's website. Today, we'll host the remaining 2 sessions. The 5th session this morning will host the transformational narratives of 5 community-led initiatives and their respective leaders. You won't want to miss this. This afternoon, the 6th and final session will explore the empirical evidence base that links community power with health equity outcomes, and will discuss implications for knowledge and strengthening the field. Remember, you can submit your questions by entering your name and affiliation below the webcast screen. Moderators will pose audience questions as time permits during the Q&A sessions. Now, before we begin today's program, I'd like to remind us of a few threads from yesterday's rich, thoughtful, moving, and even thrilling sessions. It's impossible to summarize all that transpired yesterday, but here are a few threads that struck me. 1, social determinants drive health, but power defines, drives, and shapes those social determinants. We need to move from a technocratic toward a more democratic approach to health that values people above all. 2, narratives from communities are more than an additional source of evidence, more than another tool, not just one more input into decisions. They help us confront the dominant narratives that serve power and that have already shaped what questions are even considered. Those dominant narratives can normalize racism, white supremacy, misogyny, selfish individualism, and economic exploitation. 3, there's a body already of knowledge, expertise, and proven practices around community power building. There's a diverse array of practitioners and organizations devoted to doing this and supporting it. Those of us in the health field need to connect more fully with it. 4, relationships are just as important as technical solutions, not just institutional relationships, but personal, economic, and cross-cultural relationships. 5, investing in leaders, particularly positioning youth and residents to lead in their communities and in our institutions, is critical. And finally, we are at a moment when our institutions, in many cases, are failing us. This is a time when transformational change is possible. Now, let's turn to today's program. I'd like to introduce the 2 moderators of today's first session and remind you that their complete bios are in your attendee packet. Even their brief bios, as you'll hear in a second, are astounding. Gary Gunderson oversees spiritual care services for patients, families, and medical center staff at Wake Forest Baptist Medical Center. In his position, Dr. Gunderson oversees 6 departments: CareNet Counseling, Chaplaincy and Clinical Ministries, Fair Health Education, Faith Health Education, Community Engagement, and the Center for Congregational Health and Faith Health NC. He also nurtures the relationship with more than 4,300 Baptist congregations around the state and other large networks of patient faith organizations. You'll remember Dr. Arvind Singhal, who spoke to us yesterday about positive deviance. He teaches at the University of Texas, El Paso, and studies the diffusion of innovations, organizing for social change, the entertainment education strategy, and liberating interactional structures. His work spans public health, education, human rights, poverty alleviation, sustainable development, civic participation, democracy, governance, and corporate citizenship. Gary and Arvind, Thank you for being here today and for starting us off today.